Hi, my name is Jessica Martin. I'm a student at Wilson State College, and this week I'm doing my central line skill. So I'm looking at my provider order. You can see it is just the orders and the bar. My provider order has labs needing to be drawn now, and then today we are due for a central line dressing for Chester chest. So what I'm going to do is I'm going to gather my equipment. This is for the blood draw, this is for the dressing change, and we are going to go into his room. So knock, knock, knock. Hello Chester, my name is Jessica. I'm going to be your student nurse today. So I'm just going to pull some privacy, do hand hygiene, get my gloves. Can you please confirm your name and date of birth today? And he says, Chester Chest, said 1919, and do you have any allergies? And he confirms he has a codeine allergy. Okay, thank you. So I'm just going to be taking some blood for you today. The doctor's ordered some labs to be drawn. Do you have any questions about that? And he says no, and the lab technician has just arrived in the room, so we're going to start. So if he had any infusions going on, I would have stopped that and waited 10 minutes before drawing anything so we're not compromising the labs. So we're going to clean this for at least 20 seconds, allow it to dry. I'm also assessing my line right here as I'm looking at this. Brand new saline 10 ml syringe. It's fine because I've got an extra. Okay, brand new saline syringe. We are taking the air out of it. Okay, we're going to unclamp. I'm going to aspirate for blood, and without letting it go into the syringe, confirming patency. Now I'm going to use the pulsatile method to flush our catheter. Chester, please report any pain. He is not reporting any pain. And I'm looking, there's no infiltration, nothing like that. Catheter site looking fine. Okay, so I'm going to clamp. No, not clamp. I'm going to withdraw 10 mils of blood. And this we're going to be putting into the sharps. So this 10 mils goes into the sharps. And now I'm going to take a brand new 10 mil syringe, and I'm going to be drying up our lab specimen for lab tech. So we're unclamping and drying up our 10 mils. Okay. And I give this to the lab tech, and she goes on her merry way. So they're gonna go get our labs drawn, and so we're gonna put that down. All right, so Chester, we are gonna be doing a dressing change today as well. Have you had this done before? He says yes. Okay. Do you have any questions? And he said no. Okay, so before we do that, I'm just gonna flush your line one more time after our blood draw, and then we will do your dressing change, all right? He says awesome. Sounds good. Just getting the air out of there. So once again, we are doing our pulsatile method to flush our line. After that, we'll be doing our dressing change. Perfect. Okay. So Chester, I'm first going to do is going to take a look at your site. We're going to take the dressing off, okay? Assessing the site, I'm looking for, what, any signs of infection. You can see if the dressing is loose or dirty or wet. None of those, but it's been 7 days, so it is ready to be changed. Okay, so we're just taking this off from the edges and pulling up, being very careful. Okay, and we're being very careful not to pull up the line. Perfect. So now we're going to take off old dressing. We're going to throw that away. And just assessing the site. Before I would have done that though, I would have measured the external catheter to see if it's migrated at all. So I would have done that. So now I'm going to take my gloves, take my gloves off, do hand hygiene, and we are going to setting up our sterile field. So Chester, before we start, I would have asked you to please turn your head that way so we're not breathing on the site. I'm just going to raise you up just a little bit. We would lower the bed, raise the bed and lower the head. Okay, so again, we've done thorough hand hygiene before we start. So I'm going to take this mask and we're going to put it onto Chester. And if I wasn't wearing a mask, I would be wearing a mask. I would put a new one on. And I'm going to prepare my dressing and put it in my sterile field without contaminating it. Okay. And going to be getting my sterile gloves out and putting these on. So now we are ready. I'm going to prepare the sterile drape. And I'm going to put it right here. And we are going to start cleaning around and then clean the line. Okay. So I do have to unsterilize this one hand so I can clean the line. Okay, so I'm going to do circular motions, starting from the inside, outward. Going to do that. And clean the line. Okay, so that needs to dry, and after that's dry, if I had skin prep, I would use my skin prep. And so while that dries, I am just going to get my sterile hand. I am taking my dressing, putting on my dressing. This part is dry now. There it is. And before that, if there were any crusts, I would have taken those off with my Q-tip. So I would have done that if there were any crusts. And so now that we are ready, all right, Chester, you doing okay? And he says he is. So I'm just going to take our plastic off the this the sides, and make sure my dressing is adhering to the skin as I go around, and that's working. Going to be labeling it and put my initials and the date. Okay. So now I have to roll Chester. I'm going to lower your bed, side rail up, give you your call light, take off your mask. I'm gonna go and get you some medication. The doctor has ordered it. Okay, so that's about right. All right, so I'm back at I lowered the bed, give him his call light, more privacy. I'm back at my MAR. So I'm comparing my healthcare provider orders to my MAR, and I confirm that everything matches. So I'm going to get out some drawn up ceftriaxone, and I have heparin. So I'm just going to be comparing, making sure I have all my 7 rights are correct. Ceftriaxone is appropriate, all of the information matches, and that is good. The heparin is also, during my first check, heparin is appropriate, going to prevent any blood in the leg from clotting, and the dose seems appropriate, and it has good reason to be given. Okay, so I'm going to take this to my room. Hello again, Chester. Going to do hand hygiene and put on some gloves. Can you please confirm your name and date of birth again for me? It says Chester Chest, 7/19/19. I check. Any allergies? He says coding. Okay, perfect. We are not giving any coding today. So, what I'm going to do first is again assess our site. Look at everything looks fine. Going to clean up this off, and we are going to do our second med check. So I'm going to confirm ceftriaxone, Chester Chest. Everything is correct and matches. This is the correct medication and dose and time. And same as the heparin. So we are giving 5 mils of heparin and 1 gram or 1 vial of ceftriaxone. Okay, so we've cleaned our port, and going to do 1 flush of saline first. Get the air out. Okay, we're going to use the pulsatile method. But first we would have aspirated some blood, made sure the line is patent, and then we would have started our pulsatile method. So the site looks good, and he complains of no pain. Everything's fine. Okay, so I'm locking this, and now I'm going to do my last med check again, make sure ceftriaxone, everything is correct, and it's okay to give this med. Just gotta get rid of the cap. Okay, so this medication is an antibiotic, Chester. It's used to treat infections, and we're going to give it over 3 minutes in practice. And in the skill, however, we are not going to be giving it over 3 minutes because we don't have the time for that. But in real practice, it would be over 3 minutes. Okay. Lock it to prevent air embolism, and we flush it again before doing our heparin lock. Again, using the pulsatile method to flush. Okay. So now we are going to do one last check for heparin, make sure that everything matches, is appropriate, and he needs this. Everything checks out. So the heparin, I'm going to verify with the nurse that is at 5 mLs before I give it. Verified, and I've also checked his platelet level before I'm giving this. Both are verified and are okay to give. So we're going to use the pulsatile method for the heparin. We've done our 3 med checks with all medications, and we do not flush after the heparin because this is going to prevent clots from forming in the line. Okay, so now what I would do is I wouldn't have found away my tape, so I would tape this wherever the patient would prefer, this side, that side, or facing downward. I'd ask him where he'd like to tape it. I will make sure the bed is lowered, locked, give him his call light. I'm assessing the site for anything abnormal. It looks fine, so I'm going to chart the medications I gave, the route, the dose, do all of my policy charting for the meds. I'm going to chart my dressing change. I'm going to chart my lab draw, and I'm going to chart all the times and everything I need according to policy for that. I completed all my doctor's orders, and everything has been verified. Thank you, Chester. Here's your call light. I do hand hygiene, and that's the end of my skill.